Susan, in founding the group and the work that you've done over the last few decades, can you share more about the role of children's cancer cause and how it relates to a number of the pivotal events that have happened in pediatric cancer?
Thank you, Steve. I think that uh, from the beginning, I realized that two of the major challenges that children's cancer have, um, um, really relate to the ability to access clinically all this interesting science that was emerging. As we've said, as everyone knows, the, the majority of therapies for kids are chemotherapies that were developed in the 50s and the 60s. And it seemed critical that our children really have access to the kinds of promising drugs that were being introduced into adults. And so I understood early on that there had to be that message had to be embedded in conversations at the FDA and in national committees um, that focused on drug development, cancer drug development in general, so that the needs of children, even if they couldn't be acted on, were talked about. People were reminded of these challenges. And so that was one of the key things that the children's cause focused on from the very beginning. And we have worked on the pediatric oncology drug development now for 20 years. And it is a slow process. It's a labor intensive process, but there are advances that we can talk about in another time. Both legislative and regulatory advances. Um, the second major thing that I referred to was the burgeoning number of survivors. And I realized that there was little understanding of what to do for these children who were surviving. And um, the needs of survivors were being documented, but there was no sense that of how to change the outlook for them. And of course, the question of what to do about survivors is intimately related to access to new therapies, since hopefully the survivors of the new therapies, the new targeted and, quote, these days what gets called precision oncology, medicines for precision oncology, will mollify the kinds of late effects that kids have. So I thought it was important for the Children's Cause to focus on survivors and on legislation for survivors, to pay attention to survivors in Congress, which we did, and on legislation and regulatory changes on pediatric drug development, which we also worked on from the very, very beginning. And there are milestones that the Children's Cause has achieved along the way that are, definitely worth noting. There was a volume on childhood cancer survivors from the Institute of Medicine, a volume also on pediatric oncology drug development that raised the conversation, made it more visible, those issues more visible than they had been prior to our really vocalizing about these issues in Washington. And clinically, with respect to the evolution of the Children's Oncology Group, the relationship to survivors was not only about what to do for these children and how to improve their lives, but also how to change clinical trials so as to reduce the risk of late effects. That was a risky thing to even discuss, because one didn't want to jeopardize the increase in cure rates by reducing chemotherapy drugs or by diminishing radiation So those trials through the Children's Oncology Group have been very carefully constructed. And they couldn't have been done without the kinds of coordination through the COG that that NCI has supported for these years. And I guess the other part of the focus on new therapies really relates also to NCI support, because NCI has supported not just the Children's Oncology Group, but also critical consortia, one on brain tumors and one on neuroblastoma, hard to treat, relatively low survival rates for these kids, bad tumors, and with brain tumors, of course, that it can affect all the systems in the body. And through NCI's focus support, research about these particular tumors has slowly, carefully advanced. So those are some of the things, and we have supported, of course, NCI and federal funding for the National Institutes of Health, and been participants. Many of us associated with the Children's Cause have served on committees within NCI over the years to bring home the messages that I've just talked about on behalf of kids.